Let's look at the aging process and what sun damage does. So let's look at, I've got a little picture here just to remind you about what skin looks like. So under the microscope, so of course there's the outer part, the epidermis, there's the dermis, there's melanocytes, which are pigment cells, and the dermis is that thicker part below that has nerves and blood vessels in the hair follicles. So most of this changes that we see are going to be in the outer part, the epidermis. And in fact, on the outer, this is a very simple diagram, but on the outer part, there's what's called the stratum corneum. And the stratum corneum is the area of sort of that dead layer of cells that sort of shields the skin. And what we really want to do is to get rid of a lot of the stratum corneum, so that sort of shell, if you will, because if you can get rid of some of that dead layer, the stratum corneum, the dead layer outside, the keratinocytes, then your skincare products will penetrate better and be more active and work better. We're going to talk about how Cerule products, skin products, work to do that. So our skin's made up of obviously, like I said, keratinocytes on top and fibroblasts and skin cells that are responsible for producing collagen and elastin. Collagen bundles are laid down in organized stacks. And I've got this here, I don't know if you can see it that well, but so over here on the left side, you can see collagen bundles in youthful skin are organized bundles. They're laid down like sort of like logs or sticks that are stacked. With aging and sun damage, they become, there's less production over time, and they come sort of disarrayed and sort of like broken sticks like that, like this, twisted. And that allows the skin to be sallow and lose its, I call it oomph. So it's bounce, it's spring. And then if you have great skincare products like Cerule Skin, then you're going to have more, the collagen will be increased. You'll actually produce more collagen, and they'll be laid down more regularly, so it becomes similar to more youthful skin. Elastin is the product, it's a protein that's that spring, so that snapback. So think of it like a mattress. You've got the padding, the cushion, which is the collagen, and then you've got the elastin, which is this bouncing. I see a comment here from Mark about less cover-up, less makeup. That's right, and more skincare, being able to see the skin without makeup. I hope get back to true physical beauty. So yeah, exactly, Mark. So I have a lot of patients over the years that if you give them radiant, healthy skin, men or female, well, obviously more female, they do use less makeup, and they don't need to, because they want to show their skin off. I mean, that's what we really want. You want to show your skin off, and I think that sort of the sign of health and beauty is that radiant glow, right? So we want that. Of course, there's still the balance and diet and exercise that you obviously clearly still need to do, because that everything contributes. And we're going to talk about the oral Cerule products and how they dovetail. So again, obviously sunscreen is really important. I was asked a question from one of the IBOs about a red spot on her nose and about maybe skin cancers. And yeah, I mean, there's going to be a lot of what's called actinic keratoses, or the sun damage spots on people's face as you age. And yeah, not obviously those are sun damage and can be reversed by really good skincare. Obviously, if it's a skin cancer, that's not going to change. So anything that looks like a rough border or bleeds or like a crater effect or changes size or color, then that's something suspicious, and you need to see a dermatologist for sure right away. And we can always have another talk about skin cancer type things. But the important thing is to wear sunscreen, and you need an SPF 45 or higher. You don't need to go much higher, because a 75 is not much different than a 50, just so you know. So that's important. And then, so obviously from the board, you can see your loss of collagen production, the disarray of collagen, dropping elastin production is going to lead to wrinkles, sagging skin, poor tone, and as I said, there's not enough oomph to your skin. Fortunately, the good skincare products like Cerule's improve the skin so the collagen elastin can be renewed. And yes, even after decades of aging and sun damage, your facial skin still has the ability to grow new collagen elastin. It's still never too late to use Cerule skincare. So if you think of the spectrum of who should use skincare. Well, we know that skin starts to wrinkle around, say, ages around 40, but we also know studies show that the elasticity of skin drops in your 20s already. So 20 years before you get a wrinkle, the elasticity starts to drop. This is a study done in Japan. So in other words, you should start using good skincare in your 20s if you can, and then all the way continue it. So it's a whole spectrum. It's you're almost never too young to use good skincare. I mean, I had our boys when they were teenagers using our skincare products. And again, like exercise and a healthy diet, one must continue to use Cerule skincare products as skin needs to be stimulated to generate collagen and elastin. So you can't just say, I'm going to use skincare once a week or 3 times a week or every other month. That's not good enough. It's just like saying, I'm not going to eat well regularly. I'm not going to exercise regularly. You've got to do those things all the time to have great skin.